symptoms of lipoma. So the symptoms of lipoma the symptoms of lipoma are the symptoms of classical symptoms of lipoma are the symptoms of encapsulated variety of lipoma. This is the classical, this present with the classical symptoms of lipoma. So usually the lipomas are small, but rarely the size can be large, but usually they are small, and it present in all age group. They are present in all age group, but it is rare in children. Can be present in children, but it is rare in children. The third thing is that it is painless. It is painless. There is no pain. It is slow growing. So actually we say it is slow growing. Usually the size does not change. It is fixed. So we can say that it is slow growing. It is lobular soft swelling. Then the common site. So although it can happen anywhere in the body, that's why it is called universal tumor, but it is more common in neck, back, around the shoulder, and upper limb, and in the tongue. These are the most common type. Then the overlying skin. Overlying skin is normal, and the edges are defined and slip under the palpating finger. This is called slip sign. Slip sign. So these edges are defined and they slip under the palpating finger. This sign is called the slip sign, and it is used to differentiate between a cystic swelling. And the fat is semi-solid, so there is a slight fluctuation. That's why it is also called semi-fluctuant swelling. So lipoma is also called semi-fluctuant swelling. And usually the translumination is negative, but large lipoma can be transluminant. So usually translumination is negative, and so lipoma are freely movable swelling. Freely movable. They are freely movable over the surface because there is no attachment. Plus the skin is also not attached to the lipoma. The skin as well as the underlying tissue are not attached to the lipoma. That's why the lipoma is freely movable over the surface. Plus the skin over the lipoma is pinchable. So if you do a pinch test, you can pinch the skin over the lipoma because the lipoma is not attached to the superficial skin. So these are the common symptoms of lipoma. So these are symptoms of actually encapsulated variety or the subcutaneous variety. So now let us see the diffuse variety. Diffuse variety of lipoma. So this diffuse variety of lipoma is also called pseudolipoma. Pseudolipoma. It is called pseudolipoma because it does not show typical features of lipoma. That's why it is called pseudolipoma, and it is quite rare, and it is more common in alcoholic, and sometimes it does not present with typical symptoms. So this is the diffuse variety. Then the multiple lipomas. The variety multiple lipoma variety. It is also called Lipo Mitosis. Lipo Mitosis. They are small, multiple in size, and sometimes it can be painful if there is some nerve involvement. And there is a disease which is called Druckham's disease. DERCUM'. Druckham's disease, which is the disease associated with multiple lipoma. It's a variety of lipoma which there is tenderness due to some nerve involvement. It is more common in females. It is called Druckham's disease. DERCUM'. Druckham's disease.